Today's ICD-10 quick coding tip focuses on how to correctly code and sequence category G89 pain codes with the underlying cause or site of the pain. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Pain is a frequent issue that you will encounter while coding. Codes in category G89, pain not classified elsewhere, can be used alongside codes from other categories and chapters to offer more specific information about acute or chronic pain, as well as pain related to neoplasms and surgery. If the pain is not specifically identified by the physician as acute or chronic, related to post-thoracotomy, post-procedural, or neoplasm-related, then you should not assign codes from category G89. If the specific condition causing the pain is known, you should use the code for that condition and do not assign a pain code from category G89. For example, if the patient is admitted to undergo surgical treatment for a diagnosis of chronic lower back pain due to a herniated lumbar disc, you would only assign the code for the herniated disc. You would not assign a code for chronic pain. The exception to this rule is when the purpose of the encounter is pain control or management, rather than managing the underlying condition. Category G89 pain codes may be assigned as the principal diagnosis in cases where the patient is admitted specifically for pain control or pain management. These are admissions that don't involve diagnosing or treating the root cause of the pain, but rather are focusing on managing it. If the root cause of the pain is known, it should be reported as an additional diagnosis. Let's take an example included in the guideline. If a patient with chronic back pain due to displaced vertebral disc is admitted for a steroid injection into the spinal canal to relieve the pain, the category G89 chronic pain code would be the principal diagnosis. An additional code would be assigned to capture the underlying cause of displaced vertebral disc. In this scenario, the primary goal is to alleviate the pain, not to address the issue of the displaced disc itself. Another example is when a patient is admitted for the sole purpose of having a neurostimulator inserted to manage their pain, in which case the appropriate pain code from category G89 should be assigned as the principal diagnosis. The underlying condition that is causing the pain may be assigned as a secondary diagnosis. For example, this patient with chronic pain due to post-laminectomy syndrome is admitted for insertion of a neurostimulator. In this case, the principal diagnosis is the chronic pain, followed by the code for the underlying cause, post-laminectomy syndrome, as a secondary diagnosis. However, if the patient is admitted to treat the underlying condition causing their pain and a neurostimulator is also inserted for pain control during the same admission, the principal diagnosis should be the code for the underlying condition causing the pain, with the appropriate pain code from category G89 assigned as a secondary diagnosis. For example, this patient with chronic pain due to post-laminectomy syndrome is admitted for surgical treatment of the post-laminectomy syndrome and to have a neurostimulator inserted during the same operative episode. In this case, the principal diagnosis would be the post-laminectomy syndrome, followed by the chronic pain code as a secondary diagnosis. Codes from category G89 may be used in conjunction with codes that identify the site of the pain if the G89 code provides more information. For instance, if the code only mentions the site of the pain but doesn't specify if it's acute or chronic, both codes should be assigned. For example, if the diagnosis is chronic lower back pain without a known or specified underlying cause, you would assign the code for the low back pain along with the G89 chronic pain code, because the low back pain code alone does not convey that the pain is chronic. The sequencing of category G89 codes with site-specific pain codes depends on the circumstances of the admission. If the purpose of the encounter is to control or manage the pain, you should assign the appropriate code from category G89 as the principal diagnosis, and then add the code that identifies the specific site of the pain as a secondary diagnosis. For example, if the encounter is for pain management of acute neck pain caused by trauma, you would assign the code for acute pain due to trauma as the principal diagnosis, followed by the code for the neck pain as a secondary diagnosis in order to identify the site of the pain. If the encounter is for any reason other than pain control or pain management and the provider has not confirmed a related definitive diagnosis, you should assign the code for the specific site of pain first and then use the appropriate code from category G89 as a secondary diagnosis. For example, if the patient with acute neck pain caused by trauma is admitted to rule out a spinal cord injury, and no injury or underlying cause of the pain is identified after study, you would assign the code for the neck pain as the principal diagnosis, followed by the G89 code for acute pain due to trauma as a secondary diagnosis. Post-operative pain resulting from a specific complication, such as pain caused by wire sutures, should be assigned to the applicable code found in Chapter 19, Injury, Poisoning, and Other Consequences of External Causes, for the complication. For example, for a situation where the patient is experiencing acute pain after a cardiac catheterization and subsequently is diagnosed with a post-procedural hematoma causing the pain, only the code for the post-operative hematoma should be assigned, and no additional code for the pain would be necessary. Code G893 is assigned for pain documented as being related to, associated with, or due to cancer, whether it be a primary or secondary malignancy. This code is also assigned regardless of whether the pain is specified to be acute or chronic. Neoplasm-related pain can be designated as the principal diagnosis when the documented reason for the admission is pain control or pain management. The underlying neoplasm should be reported as an additional diagnosis. For example, if a patient with acute pain due to lung cancer is admitted to the hospital for pain control with no care directed at the malignancy itself, the principal diagnosis would be the neoplasm-related pain with an additional code assigned for the malignancy. When the reason for admission is to manage the cancer and associated pain is also documented, you can assign code G893 as a secondary diagnosis. There is no need to assign an extra code for the specific site of the pain because the site of the cancer indicates the site of the pain. For example, for a patient with a diagnosis of lung cancer with chronic pain who is admitted for chemotherapy, the neoplasm-related pain would be assigned as a secondary diagnosis along with the code for the malignancy itself. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.